Hi, welcome to the Holistic Health and Nutrition Clinic community. My name's Dr. Kate Barry. I am a functional nutritionist, a health coach, and a science educator. And I truly believe that a functional approach is the answer to our current healthcare crisis. So that's why I created the Holistic Health and Nutrition Clinic as a way to kind of provide functional solutions for patients and clients alike. So a little bit about my story. My road to understanding, I guess, the power of nutrition in healing began with my own chronic illness. So after 8 long years of study, I was finally working in my dream job at a Sydney university. Life was really grand, and not only was I kicking goals at work, but I also had a very fulfilling personal and social life. You know, I had no shortage of invitations to barbecues, parties, restaurants, etc. And then in 2016, seemingly out of nowhere, I began to feel dizzy and off balance to the point that I couldn't walk anymore or think straight. And, you know, I saw a variety of doctors actually at the time, and they put it down to an inner ear issue. But a week later, I noticed that my limbs started to feel numb. Different sections of my arm and leg, particularly the left side, started to feel numb. And my face was also numb, and I knew that something was really wrong. So over the next couple of years, I visited a multitude of doctors, specialists, ERs, lots of GPs. And often I was being told that I was either just depressed, or stressed, or, just that I was really exaggerating was often a common comment by doctors. And, I was told that the symptoms would eventually resolve on their own. I had lots of scans and tests. They always came back normal. And then I decided to take things into my own hands, and I borrowed many books from the local library, and I started to really research anything I could about diet and lifestyle and their effect on health in general. And so after reading a lot about inflammation, I decided to put myself on a strict autoimmune protocol type diet, and that was that was a huge leap of faith for me personally, because I had been vegetarian and or vegan for the previous 15 years. So that was a big change for me. But I wanted to see what would happen to my symptoms. And I definitely noticed quite some improvement in my symptoms, but I didn't get anywhere near what I would call, full resolution from those symptoms. So I also read about functional medicine within those diet and lifestyle books. And I decided to take another leap of faith then and visit a functional medicine doctor that was in my area. And I'm so thankful I did. I was eventually diagnosed with chronic inflammatory response syndrome, often known as mold illness. And I then realized that my workplace was riddled with mold, and that, that mold and those mycotoxins had been building up in my system for a very long time. And I just kind of hit a tipping point, and that's when the symptoms became really obvious. And so, it was great to finally know what was causing my symptoms, or at least what had tipped me over the edge. And even more importantly, I felt acknowledged and heard by somebody in the medical profession, finally. So I started on a very specific SIRS treatment protocol. And after about 6 months, I could really start to feel myself, my personality and my life coming back. But unfortunately, the story doesn't end there. I wish it did, but it doesn't. So since then, I've struggled with fatigue, been diagnosed with chronic fatigue syndrome, and for those of you that don't know a lot about it, it's a very debilitating condition that is underdiagnosed and very poorly understood by the conventional medical system. In the latter half of 2018, I was actually bedbound. And it seemed that even my functional medicine doctors were kind of at a loss to help me. They didn't really know where to go next. And my gut feeling was that even though I had detoxed from the mold and that I no longer had those kind of neurological symptoms, that the mold, or at least the mycotoxins, had done some serious damage to my system, maybe to my cells. I didn't really know the mechanism, but that was my gut feeling. There was some damage. My system was kind of having trouble recovering. So again, I decided there had to be something more I could do in the kind of diet and lifestyle realm. So I enrolled in lots of online courses. I listened to podcasts. I attended virtual conferences, and I read many, many research papers. With my background as a research scientist, I have access to those, and so I tried to read as much as I could about health and nutrition. And so I implemented a lot of the strategies that I heard. I kind of mixed and matched and tried things out. And I started to improve. And I improved to a point that I could actually start working it from home. I'd had to have 6 months off. And so I started to work from home again, and I did basic kind of housekeeping activities like cooking and vacuuming. I just started to come back to life a little bit again. Now, since then I've had many what I would call dips. Some people call them relapses or crashes. I've had many dips since then, some more severe than others. But each one of them teaches me something about where to go next on my journey. So once I had attained a certain level of wellness, my brain also started to come back online. So I had quite severe brain fog at various times throughout, that recovery period. And once my brain came back online, I realized I had a choice. I could either let the illness define my life in a purely negative way, which is very easy to do when you're not feeling well, or I could at least try and find the hidden opportunities within that illness. So I then became determined to understand the mechanisms that lead to chronic illness, that led to my chronic illness, but lead in general to chronic illness, and to understand how and why the body reacts as it does, and really to try and discern the aptitude that we have to unlock our own healing potential, particularly using the keys that nutrition can provide. And this then inspired me to return to formal study. And so then I trained at the Health Coach Institute to become a health and life coach. I learnt about healthy eating habits, to energize the body and to come back to life, and how to share this knowledge with others, really about habit change. But that wasn't enough for me. I really wanted to help people like me that were struggling with chronic illness. And I knew instinctually that, that health coaching training wasn't enough. I needed to take the training further. And so more recently, I've completed training in functional nutrition through the Functional Nutrition Alliance. And I hope to continue on this path over the next couple of years with more advanced training in functional nutrition and lifestyle. And this intensive functional nutritional training has had me deep diving into the systems of the body. So I've kind of been revisiting all that I learned in my undergraduate and postgraduate biology training, but in a much more practical and functional way that is more relevant to human health. So what I have learned is that when practitioners take a functional approach, so asking questions, fostering therapeutic partnerships, taking the time to find the unique root causes for each individual, people can find levels of vitality they never thought possible. So I never want my clients to feel unheard, as I did, to feel like they are a burden or a lost cause, as I did. So the Holistic Health and Nutrition Clinic is where patients and clients can empower themselves with nutritional insights and connect with a functional nutritionist, me, for dedicated one-on-one support. So what I think is that we need to change the way healthcare is addressed on a global scale. And HHANC, or the Holistic Health and Nutrition Clinic, is my contribution to that healthcare revolution.